Welcome back, everyone. Now we're talking about the warning signs and the prevention of stroke. Here's Jeff Smith in touch on this Sunday morning.
Well, good morning. Good to see you once again here on In Touch for this Sunday. My name's Jeff Smith. Want to introduce to you Dr. Richard Burgess from the University of Toledo Medical Center, joining us from the neurology department. I bring you on here, doctor, reading articles, seeing the wire copy that came down about Dan Gilbert, Quicken Loans, Cleveland Cavaliers owner, suffering a mild stroke this last week. Very guarded about the information that came out about his condition after that initial read on what had happened to him. But you're talking about a man kind of in the thick of life, in his later 50s. I am approaching 50, so I start to get a little antsy thinking, am I next? Talk about the age factor of all this. And was Dan Gilbert too young to have a stroke?
Certainly not. Unfortunately, younger and younger people are having strokes these days. It's been a bad year for celebrity strokes. You look at Luke Perry, Dan Gilbert, Amelia Clark, all of these are young people who've had strokes. Certainly what we see is that younger and younger people are having strokes.
What do we attest, or what do we attribute to this kind of, I guess, it being played up more and more?
Yeah, I think a lot of it, at least in the broader community, perhaps beyond the celebrities, is due to creeping diabetes, high blood pressure, smoking, high cholesterol. A lot of the usual risk factors for stroke, unfortunately, they're affecting younger and younger people, and therefore these people are having more and more strokes.
Are we unhealthier? Is that what's bringing on stroke conditions?
Absolutely. I mean, in America, we hear about the obesity epidemic, and we see more and more people who have these disorders that we previously only saw in older people at younger and younger ages.
I wanted to throw out, as we're talking with you here, once again, Dr. Richard Burgess, University of Toledo Medical Center. I want to throw out some statistics for our viewers as well. The Centers for Disease Control putting out a few things here for you, and just staggering stuff when you look at this, doctor, but this is stuff you deal with every day. Knowing the facts, 140,000 Americans die each year from stroke, one person every 4 minutes, leading cause of serious long-term disability in adults, and 85% of the cases involve ischemic stroke. Talk about that, the differences between the two.
Well, I sort of look at myself as a plumber for the blood vessels in the brain. And as a plumber, I deal with clogs and I deal with leaks. And that's essentially how it works.
It's a great way to put it.
Yeah, so ischemic strokes are the clogs. That's when the pipes clog up. Hemorrhagic strokes are the leaks, or when a pipe bursts, or there's blood that gets out of the blood vessel.
Yeah.
So certainly most of them, 85%, are the ischemic, the clogging kind, and a smaller proportion of the leaking kind of strokes.
Part of the Dan Gilbert story is the fact that he went to the hospital early. We're learning that he went to the hospital early, not feeling well, and all of a sudden he had the mild stroke while he was there in the hospital. Early detection, obviously important. What about treatment? What did the doctors do?
Well, I don't know his particular case, but
if he had an ischemic.
Right. What it sounds like, based on the media reports that I've seen, is he had a catheter-based procedure. And what that means is that rather than using the medical equivalent of Drano or liquid plumber to break up the clot, that they snaked out the drain, if you will. So in the same manner that a cardiologist might puncture a blood vessel on the leg, a nice safe place to go into a blood vessel, you're actually able to drive up a catheter, something that I do all the time, up into the neck and then up into the brain. And you kind of use that as a vacuum cleaner. Or perhaps we'll put a little grappling hook through that tube and we'll grab onto the clot that is obstructing the blood vessel, that is keeping the blood flow from getting downstream to the brain and causing the stroke. We'll actually pull that out. We call that a mechanical thrombectomy, and it's been a revolution in stroke treatment in the last few years.
And what is the clot, essentially, in layman's terms?
Sure. Well, it's a blood clot in the same way that if you cut yourself, your blood clots there. There are certain conditions that lead to blood clotting in either the heart or the blood vessels. These things are the same risk factors that typically cause stroke. High cholesterol, diabetes, high blood pressure, they damage the lining of the inside of the blood vessels. And in the same way that a Teflon pan, when it gets worn out, things start to stick to it, your blood vessels, when they get worn out from these conditions, blood starts to stick to it. And then it sort of builds up into a ball, and that can break loose, travel throughout the body. If it goes up into the brain and clogs up a blood vessel, that causes a stroke.
Great references for our audience this morning. We've got women, we've got men watching. So where are the risks as far as the sex is concerned of the patient?
Well, it turns out that men are more likely to have strokes. Having said that, women live longer, and so actually more women overall have strokes than men.
Let's describe FAST for people and what that means. It's an acronym that a lot of medical experts, including yourself, will tell you could save a life.
Absolutely. So the most important thing in dealing with stroke is time. Every minute that goes by that clots in the brain is another minute where brain cells are dying. And so we want to recognize the stroke quickly, and we want to get the patient to the hospital. And what we tell people to look for are FAST. That's face, any facial paralysis, facial drooping, arm weakness or numbness, speech, slurred speech or difficulty speaking, and then time. Call 911, get to the hospital as soon as you can.
Let me ask you a question, and this may be a silly question, but are these recognizable factors for somebody else? Or am I going to have my faculties about me that I can recognize it's happening?
I suppose it depends. There are some patients who are able to detect what's going on. I even have some patients that the hospital themselves. It's not something I recommend. Having said that, most of the time it is bystanders or family members who recognize these things because the patients often are not able to.
I guess the easy answer is take better care of yourself. But is there anything that I can do, anything that our audience can do to try to prevent this from happening to us?
Well, as you said, we're getting into that age where we're in that category, and I think that all of us can eat a little better, we can exercise a little bit more, but we can make sure that if we have bad habits such as smoking that we stop. And you can talk to your doctor about your risk factors. Make sure that you don't have high blood pressure that you don't know about, or that your diabetes is well controlled, or perhaps your high cholesterol. So it's important to have a healthy lifestyle and talk to your doctor about your risk factors.
If it's in our family history, how does that play into it?
Certainly family history is a risk factor, and nothing you can do about that one. But it turns out that 80% of strokes are preventable. If you talk to your doctor, get your risk factors controlled, you stop your smoking, 80% of strokes are preventable.
Just like that. Doctor, good stuff. We appreciate it. Dr. Richard Burgess from the University of Toledo Medical Center. Now you are more in touch.